More than 1 million people suffer from eye injuries in the U.S. each year, and October is Eye Injury Prevention Month. And today we're pleased to welcome Dr. John Kitchens of Retina Associates of Kentucky to tell us more about preventing and treating eye injuries. Thank you so much for being with us today.
Thank you, Christy. Thanks for having me.
We were talking a little bit earlier, and you were saying that what's unfortunate is that so many of these eye injuries are preventable. What do folks need to know about preventing them from happening in the first place?
Absolutely. Christy, in the eye injury prevention realm of things, it's really important to wear safety glasses, and to be aware of the things that you're doing that could be dangerous activities. But the number one thing that could prevent eye injuries is to wear safety glasses when doing various activities. And the other thing to know is that a lot of these injuries actually occur at home. About 50% of reported eye injuries occur at home. Most people associate eye injuries with the workforce and getting injured at work, but a lot of common everyday activities can actually injure your eyes.
And who is at greatest risk for hurting their eyes?
Well, everyone's at risk, especially the active people. The most common age range for eye injuries are between the ages of 20 and 45. But about 20% of all reported eye injuries occur in patients under the age of 18. And so kids are very prone to eye injuries, especially with athletic activities. About 50 to 60% of children's eye injuries occur during some sort of sporting events. And so taking proper precautions with that is really critical as well.
And we're seeing some photos now of some of the examples of different kinds of eye injuries. What are some of the things that are typical to see?
So the picture we're seeing here is actually a metal foreign body embedded in the cornea. And where you get something like this is if you're hammering on a nail without wearing safety glasses. And it's really important when you're doing these things to always keep in the back of your mind, could this injure my eye? Could something fly off of here? And things like that. Hammering on metal is one of the major things that can injure an eye. This is a corneal burn that occurs from either an acid or an alkali injury. So drain cleaner inadvertently spilled into the eye can cause a very, very severe eye injury. It's important if you get any drain cleaner or other products into the eye to flush the eye copiously and to check in with an eye doctor in an emergency room right away.
And you mentioned with if folks do have an accident or something that happens about getting that treatment, it's got to be incredibly important to try to do that as quickly as possible to save vision, right?
Absolutely. Some of these injuries, they can feel better for a short period of time, but for example, with an eye abrasion, if you scratch your eye putting your contact lens in, that can get infected. And so it's important to see an ophthalmologist or an eye doctor to be checked out and to make sure that you're being treated appropriately for that eye injury.
And if folks are interested in learning more about some of the services offered through Retina Associates of Kentucky, that phone number and website are listed on the bottom of your screen. And sometimes it may require surgery. Or what's the general treatment course?
Yeah, most of the time it's more conservative than that. Sometimes we can place patients on antibiotic drops, patch them to make them more comfortable, give them certain drops to make their eye feel a little bit better, maintain a close follow-up to make sure that none of the severe adverse events associated with eye injuries occur. But sometimes if it's a very severe eye injury, we can certainly take them to surgery and in many cases have a successful outcome.
So you mentioned treatment options, but of course prevention is the focus now this month especially.
An ounce of prevention is truly worth a pound of cure.
Wonderful. Well, thank you so much for sharing that important information with us. Again, you see the information at the bottom of your screen for Retina Associates of Kentucky. We'll be right back with a check of your forecast. I'm hoping to be able to put the sunglasses on today to see the sunshine come out. How about it, Mary Watson?
Well, you know what? The sun's come out a little bit this morning, and it will continue to see those clouds thin out as the day wears on and temperatures heating up. I'll show you that full 7-day forecast coming up in just a few minutes.